Welcome everyone to the COVID-19 UIO Open Forum titled It's Only at the Top, Connecting to Each Other for Creative Solutions. We are honored to have you here today. We are kindly ask you to place your name, your organization, tribal affiliation, and title into the chat box below. As we begin our session. In addition, we welcome any feedback for surveys, which has been posted in the chat box for you to take at the end of today's open forum. And if you are now recently joining, we welcome you again to the COVID-19 open forum titled It's Only at the Top, Connecting to Each Other for Creative Solutions. And we just kindly ask for those who have joined us to place your name, your organization, tribal affiliation, title into the chat box below as we to start this session. Can we switch to the next slide, please? So before we start the session, just want to share a little bit about NCUIH. As all of you might know already, but NCUIH is a national nonprofit organization devoted to the support of development of quality, accessible, and cultural competent health and public health services for American Indian and Alaska Natives living in urban areas. We represent 41 urban Indian Title V organizations under the Indian Health Service Act to improve the health of over 70% of American Indian Alaska Native populations that live in urban areas, supported by quality, accessible and health care centers. Next slide, please. So before we get started, I just wanted to go over some housekeeping items. Today's open forum is being recorded. All mics are muted unless otherwise directed. Please turn on your camera to allow interaction if you're able to and can. Questions and comments can be typed into the chat box. This session really is to help with urban Indian programs to share your feedback on COVID-19 wins, challenges, concerns, and thinking about how NCUIH and yourselves to plan and prepare for helping your Native communities beyond COVID-19. There will also be a Q&A session that will be offered at the end of today's open forum. And if anyone wants slides to this session, they will be provided on the website and provided to you also after today's open forum as well. Next slide, please. Just to go over one other thing in regards to housekeeping, and a lot of you probably already know, working in the virtual world, but if you needed support asking a question or a comment, just clicking on the chat box image and below, and then there'll be an option for you to respond to everyone, or if you had a specific question to an individual person, you could do that too. But I think this is just the process of being able to and giving directions on how to ask a question or a comment. Next slide, please. And the survey, we ask also to just please don't forget to take the survey to help us improve our services to you, but also to think about how we can better prioritize and plan other ways of really building your capacity and helping all of the great work you do throughout Indian country. So we really appreciate if you do take the survey, and there will be a reminder later today at the end of today's open forum. Next slide, please. And I just wanted to share some upcoming events with everyone. also that's happening that NCUIH is hosting. Uh, there is a high performing boards in the virtual world session, um, session 3 that will happen tomorrow at 6 p.m. Eastern Standard Time, and it's going to be focused around the board's role in safety, quality, and compliance, and bring it all together. So uh, I think this is our the last session of the board of director training that series we have, and then the next two events that are also occurring is um, COVID-19 infection control session on good ventilation and air handling as part of infection control, part of our Project First Line work that NCUI does with our urban Indian programs. And then lastly, just letting everyone know that our Circle of Resilience Conference, Empowering Indian Country in a Virtual World, is occurring at the end of this month, May 25th to 27th. So if you have not already done so, please register. There's a lot of great opportunities and trainings and um, uh, topics that will be covered that will be beneficial for urban Indian programs. So those are just some of our events coming up. Next slide, please. And then I just wanted to go over how the rest of today's agenda is going to go. I will be doing a introduction to the facilitators, including myself, uh, and then going over the open forum overview, providing that and some guided intro and the purpose of today's open forum and why we hosted this. So that will happen, and then we will go into our open forum session um, that will be covered based off of three topics. So COVID wins, COVID challenges, and beyond COVID-19, 20 minutes each. And then there'll be a Q&A session afterwards if there hasn't been any questions if there are still questions that have not been answered or that need to be comments that need to be addressed. And then we just will close out today's session really thinking about next steps from today's conversation, and uh, just a reminder to take the survey at the end of today's open forum. Next slide, please. So to start off, I'm today's host, Sabu Kuyumjin. I'm the Public Health Associate for Technical Assistance at NCUI. A little bit about me, I'm Indigenous Egyptian and Armenian. I've been working with Indigenous communities for the last 4 years. I'm I'm a health professional with over 5 years of experience focused around mental health, trauma-informed care, substance abuse, and suicide prevention, as well as health policy and advocacy. Um, I lead various projects at NCUI around urban Indian organization capacity building, uh, behavioral health, Native youth leadership, sustainability, support for programmatic growth, and really advancing Indigenous focused research. Got my Received my master's degree in public administration, health service administration from the University of San Francisco. Next slide, please. Our our next facilitator for today's session is Meredith Ramondi, Director of Congressional Relations. Uh, Meredith has over a decade of experience in government, political campaigns, and nonprofits. She served as Obama's appointee at the National Endowment for Arts. She was a staffer for Congresswoman Betty McCollum for over 7 years. Really, she specializes in using digital and online communications as tools for advocacy, campaign causes, and fundraising. Um, Her work has been an experience in her work has been seen in the Washington Post, New York Times, New Yorker, The Hill, Good Morning America, and Meredith has a bachelor's in arts and philosophy from George Washington University. Our next slide, please. Our last facilitator for today is Andrew Kelwick, and Andrew is the Director of Research and Public Health Programs. Andrew has over 6 years of experience conducting research at the intersection of behavioral health sciences, community programming, and social services for youth and families. Andrew manages a variety of research and technical assistance projects. Um, Andrew holds a master's in public health from Harvard with a focus of social determinants of health and disparities. And Andrew also has got his bachelor's in science and chemistry and comparative human development at the University of Chicago. Next slide, please. So now moving on to our open forum overview. So today's open forum really is dedicated to our UIOs, diligently working to keep families, friends, and community safe. Today's open forum really is to, our hope is to connect heroes with one another to share best practices, challenges, and future areas of need, as well as being able to have NCUIH staff on hand to help answer questions or obtain feedback that will inform our future initiatives and UIO advocacy for all of you. Next slide, please. And the forum, as I mentioned earlier a little bit, is 60 minutes long. The session, the open forum itself, there will be, it is facilitated into 3 topic areas, and those include COVID-19 wins, COVID-19 challenges, and then also thinking about beyond COVID. Each topic will be facilitated for 20 minutes by Meredith, Andrew, and me. And there will be a 10-minute, additional 10 minutes of Q&A for questions that have not been answered during those 20-minute sessions. So please make sure if there are questions or comments you would like to add, and we go into the next topic, we will bring in the Q&A, we'll try to address those comments and questions. And then there'll be a 10-minute portion of today's session really just focusing on next steps, a survey reminder, and really adjourning our open forum. So that's kind of the overview and kind of a guideline of what our purpose here today. So next slide, please. So starting today's forum, I will begin our first topic and start the discussion and hear your stories on strengths, wins that each of your UIOs have experienced during the pandemic. This could be any positive change your UIOs have made during the pandemic. And so our first question, next slide, please, is, what are some big wins? Like, what are some areas and strengths that you, as in your specific UIOs, have been able to pivot, or something that positive came from this pandemic that helped your urban Indian programs and the communities that you support? And I want to open up the floor. You can unmute yourself. If there are questions, you can type them in the chat box. This is really the time for this is a space for to hear from you and to see what are some strengths and some positive experiences you had as a result of the pandemic for the work you do in supporting our communities.
Sure. Hi, this is Angel. I don't know if my audio quality is going to be good. I'm driving right now. Thank you. It was really nice to hear your guys' introductions. I appreciate that. All the time that I join one of these sessions, I learn more and more and more because you guys offer really good information. I'll get to the point. I think the question is really great. I just want to say that Bakersfield American Indian Health Project was a bit concerned at first when COVID hit us all. You know, we were all learning at the time. We were all really pivoting in a way that we were not used to. You know, this just sort of hit us all by surprise, and CEOs and COOs had to make very difficult decisions to lay people off and still also worry about providing care. So it was not easy times, nonetheless, for none of us, especially for me. I do want to say that I think with COVID and those who just stuck it out and those who were champions and all of the work, and I'm meaning all of the members of our team and the nurses and the doctors and the MAs and the behavioral health clinicians and the therapists, all of them who were willing to sacrifice themselves and put their health at risk to really engage the community, because we started seeing people getting sick, we started seeing people dying, and it was not easy. So at the administrative level, I took it upon myself to really redesign and revamp the way we operate, in that we were able to provide certain types of care that we were never able to provide prior to COVID-19. Some of those cares were like providing emergency housing for folks who lost their jobs, providing immediate outreach and engagement to those who were to COVID and did not have any prevention materials like PPE or sanitary type, hand sanitizer, those kinds of things. So we got really strategic in that we were able to even purchase vehicles with COVID. We BIHP did not have the ability to purchase its own vehicles because we were not, we don't bill third-party revenue, so we had very, very shoestring budgets that we could not purchase vehicles through. But with COVID, we were able to write it in our scope of work to allow for BIHP to purchase vehicles in order for us to make that, make the access of care possible for folks who are requesting to test, who are requesting to vaccinate, who are requesting to really get the services that otherwise they could not get because many of them were homebound or many of them were under the orders, stay-home orders. And so I think those were a few of the wins that I could say that our organization was able to accomplish with partnerships like yourself. I mean, we were even able to move into a position of being able to purchase our own electronic health record system because the capacity, I mean, we're running off of our PMS and our technology capacity was very limited. So all of these things were a huge win for us. And I just wanted to thank all of the partners like NCUIH and IHS and the CDC. Those, without partners like that, I think BIHP would have been probably, would have ceased to exist, to be honest with you, because as many organizations felt the budget constraints, now we're seeing some of that come back. But or a small organization like ours, probably the smallest in the state of California, would have not survived COVID-19. It would have probably perished along with many of the other community organizations that unfortunately did not make it through this economic crisis. But I just wanted to put that plug in because I think people like NCUIH, or organizations, I should say, like NCUIH, with people like yourselves who are willing to go the extra mile and work the extra hours, made it possible for us to really reap that benefit. And for that, I'm very grateful and I'm thankful. Thank you for giving me the time.
No, thank you so much, Angel. I appreciate your story and all of the, just, I think it's nice to hear the strengths, right? Like of things that you're able to do, from purchasing vehicles to EHR systems, and we appreciate your support too. I think this is a reciprocal partnership, right? So we help one another. So thank you really for providing that.
Yeah, you bet. I think if anything, if I've learned anything, is just to stretch the envelope as far as you can. We have, you know, we have some of our COVID funding is permitted to pay for temporary housing and indirect housing supports, as well as there's a program that we started where if somebody lost somebody to COVID, in other words, I get the phone call probably every other week. Hey, I just lost my wife, or hey, I just lost my son, or hey, I just lost a loved one to COVID-19. Can you guys help us with the funeral expenses? This was all unexpected for us, and we can't afford it. And of course, I can't directly. Our organization does not. The funding that we get does not allow for direct relief. However, we were able to do indirect relief in that we created like a utility and rental support program for 90 days, where indirectly they qualify because of the loss for that financial support. And I think it wouldn't have been possible if we didn't have the flexibilities within the COVID-19 funding to do a program like that. Now, there are other resources that address those kinds of needs specifically through like county resources or state resources, but the list is very long and the process is very lengthy. And that's one of the benefits of having an urban Indian organization in local communities that serve Native Americans, because that I guess application process or from start to finish is very, very expedient. And it just adds a layer of comfort for those for all of our Native American population who in a time like this, they don't have time to wait. You know, they can't wait 2-3 weeks before you give them an answer. They need an answer right then and there. And so, you know, those are huge wins for us, because we're able to provide services expediently on the spot. And we're just hoping to continue to do that as the future of this pandemic continues to impact the lives of our Native American people. Thank you, and sorry for taking too much time on this message, but I felt like I had to say that.
No, we really appreciate it. I think that you shared a lot of great stuff, and I think that leads us to another question we want to ask folks. Next slide, please. What are some effective strategies that was most impactful for you as urban Indian programs? What strategies that were used to help? And that could be like policy changes, that could be things that you did to help with a lot of these wins, right? Like as Angel mentioned. So if there's other UIOs that would like to share, if were any like strategies that were effective, that helped your urban Indian programs, this is really a time to share and to share with one another, to see if that's something that maybe another urban Indian program might not know of, or would like to utilize themselves to better help their communities. But I really wanted to kind of put that question out there, and what effective strategies were most impactful for to help with some of the wins that each of your UIOs seen in the wins that you experienced.
Hello, Sabu. I just wanted to make the observation that our chat box features a post from Andrew Collate about resources. And there's a link to FEMA that's posted in there for those who are seeking financial assistance for COVID-19 related burial or even funeral planning. And that covers funerals or services dating back to January 2020 retroactively. So the link is posted in our chat box for those who would want to look for that kind of support from FEMA.
Thank you for that, Mark. And thank you, Andrew, for the resource. Really, really helpful. I wanted to maybe try to think about this in aspects of, you know, were there any guidance or policy changes or actions that were done at the federal level, at the state level, that helped with maybe using an effective strategy to help with some of the work that your urban Indian programs were doing on the, are doing on the ground. I think just asking that to see if there were any policy changes that really helped with a lot of the work that was impactful to help your communities during a really challenging time that we're in.
Can I ask a question about one of the things Angel said on his about a strategy that he was able to use?
Yeah, I think Angel is going to talk right now, Meredith. But just
Sure. No, I'm happy to hear the question. Or the strategy. What was the question?
My question to you, Angel, was what when you mentioned the indirect funding you were able to utilize for funeral assistance, what was that through IHS or was that through the FEMA system?
Yeah, so it was not FEMA, and the assistance was not directly for funeral expenses. The assistance was indirect, meaning that we were able to create a program that would cover the patient's rental and or mortgage payment for 90 days as well as utilities. So the idea here was that the impact of the loss of their family member created a financial impact because of, you know, they couldn't afford obviously the funeral expenses. So we had to indirectly create a program that in a sense would still directly benefit the patient. So this was out of our IHS funding, not 350 contract.
I think you were on mute, Angel.
Yeah, we just lost you for a second there.
I think
Sorry, folks. I'm driving and I catch a little bit of these bad areas. I hope you guys caught that, but it was not FEMA funds, not directly for it's not directly for burial assistance. It's a program a 90-day program that offers utility and rental assistance by using our COVID-19 CARES funds. I think we were paying it out of actually the PPPHC. I can't remember what the whole acronym is, but it's the COVID-19 funding we were allocated. We were able to write that program through that.
Thank you. I appreciate that hopefully other people can utilize that information as well. I just thought that sounded like a good strategy and I wanted to clarify because I know that the FEMA money has been a lot harder for folks to navigate through, but maybe this sounds like a different way to approach that situation.
Correct. The other strategy I think that would be helpful, it's not one we use very well, is to have someone coordinate with their tribal affiliation, because here the local tribe for the Tahoe Indians, we had recently one member of the tribe who had lost his wife to COVID, and the tribe was able to provide the funeral assistance, financial assistance. So in some cases, some tribes are helping their members, but in other cases, that is a little more challenging. So, you know, we're doing our part, and we do get a lot of referrals from the tribe because the tribe has limited resources. But for something like that, the tribe did have funding where they can cover those costs. So we went ahead and still qualified the individual for the additional services or supports, and it was up to the individual whether they elected to receive it or not. But that's another strategy, is that we contact their tribal affiliated Indian reservation and see what kind of services they have too, whether they live on the reservation or off the reservation, because some of them are helping their members, some of them just can't. But that's another strategy perhaps that might help everyone out in the event of a loss.
Thank you so much. I appreciate you sharing that.
Sure.
Thank you so much, Angel, for that. I think wanted to just also get into our last topic of questions for this specific, or the last question for this topic on wins. Next slide, please. And just seeing if um, there are any resources that could be shareable with other urban Indian programs that were shared today in regards to like strategies, or maybe thinking about like how to even come up with a program that would be helpful for temporary rental assistance, or for folks who have lost loved ones. And I think that's something that we're still experiencing to this day, right? So it's like, I think that it's because we're not completely out of it yet, like I think it's something that maybe might be helpful for other urban Indian programs. But I don't know if, Angel, if you had like at least like a general program like overview of how it's done, maybe that would be something that could be shareable with other urban Indian programs you could provide.
Yeah, sure. I'd be happy to. It's really a lot of outreach and engagement. We post these things on our website, but we also mail. We do regular mailing out to all of our registry, all of our patients, active patients or not. So we have about a little over 1,500 in our registry going back 5 years. And so we've even gone the extra mile to really target all of those in our system for the last 10 years. And that number was about roughly 2,500 Native Americans in Kern County. So we regularly mail out all of the resource informations and programs and services. From the administrative level, we have a couple of peer support specialists who are very familiar and very well adapt to not only the resources internally, but the external resources. So it is a very time-consuming, if you will, management. But if you train one or two of your peer support specialists, whether they're in the behavioral health side or a medical assistant on the health side, train them up to understand what all the resources are, and then you have a little bit of a better organized delivery system for those who are calling the offices and asking for the various resources. So we handle it at a micro level in that way, that we're just advertising. We continue to post a lot on Facebook, Twitter, and Instagram. We use our partners' social media platforms as well. And we participate in a lot of different partnership calls from the county, from non-NGOs or NGOs. And we just continue to send that message. We have housing supports for those who are experiencing homelessness due to COVID. We have the utility and rental support. And here's another thing too, is that we have a local tribe, and we have a great partnership with the chairman of the tribe and their council. And as part of our collaborative efforts, we share with them information that we want on their newsletters. And so we have we have one person in our office that handles media, and that person's primary job is to contact all of the PIOs or the media specialists within these various organizations and add content to their newsletters so that we're leveraging those resources as well. And that's been very effective in that it's been outreaching a lot more individuals. We have people that said, hey, I'm Native and I didn't even know you existed here in Bakersfield. And so, those are great successes to hear people calling us saying, hey, I didn't know you guys were around and provided Native services for Native Americans. I'm Native. I came from such and such, state, and I've been living here for the last 5 years. And I'm so glad you guys are there. And then we end up coordinating that person with one point person or two. And that one point person or two becomes really their sort of case manager, if you will, until they've met every single unmet need they're asking for. Now, of course, we have limitations. We can't provide it all. We can't solve it all, but we do the best we could with what we have to ensure that everybody knows of us and that they get the care that they need, whether it be by us, through us, or, and so that's kind of how we handle that. And it's very effective. It's working very effective.
Thank you so much, Angel. Really, really helpful. And thank you for the strategy and willing to share with us all the helpful ways that your program has been able to be successful in getting helping more folks at the end of the day. So thank you for that. And we'll just follow up with you and see if there's like a document or some kind of overview of the program to share with the UIOs about the temporary housing program that was created.
Sure.
Thank you. So to move us on to our second topic, topic area for facilitation, I will give the mic to Meredith Ramondi, our Director of Congressional Relations, to help facilitate our next open forum topic on COVID-19 challenges. The mic is all yours, Meredith.
Okay, thank you so much, Sabu. So I just wanted to take a moment and see who else is on our call today, who are Urban Indian Organization leaders or staff, if you could identify yourselves. I think we, is Natalie on the call today? Or Janelle or Rachel?
Hello, I'm on the call today. Hello, everyone. My name is Janelle Pokwachet. I'm the program manager for Native American Lifelines of Boston.
Good to hear from you, Janelle. And then,
good to hear from you, Meredith, too.
Okay, and then I see also Lorene is on here. Just wanted to say hello to you in addition to Angel. And our next question will be about what was your biggest challenge of the past year? And we left this question broad to give you an opportunity to just let us know, if you could. I sometimes say to folks, if you could wave a magic wand and fix one thing, what would you fix? It could be now or in the past year.
Get rid of COVID.
I think that's a good answer for that one. Would you say your workload increased significantly over the past year, Janelle?
I couldn't get that. What you say, Meredith?
How did it impact your workload, and in the past year, what has changed?
It, taking over regular programmings that we do with our clients and not being able to see our clients, especially our elders.
And do you find that's because of transportation issues or technology issues, or what do you think leads to the fact that it's harder to see the elders right now?
Because of the COVID, it's not transportation, mainly being careful around our elders and our clients.
Yeah. So, and
not connecting care and seeing them less.
And just not knowing as much how they're doing then.
Exactly.
Yeah, that's a major issue. Are you finding that things have improved at all more recently?
Yes, since some of our elders are vaccinated, I've been going out with, mainly being prepared with PPE and visiting those who are already vaccinated, but still being protective and wearing the PPE.
And how do they seem to be getting on right now in terms of their mental health?
They're dying to get out and to do things, especially ones that are like they're tired of staying in, and the barriers that they face each day of not you know, what ifs, I don't want to go out and get COVID. What if I catch COVID? What it's going to do to me?
Yeah. So
How will it affect me? How will it affect my living, you know?
Yeah. No, that's very helpful. And I'm sure, you know, there's a lot of fear around all of that for folks.
And plus getting like the people to come out to get vaccinated, because we will be having an upcoming mobile clinic with vaccines, and we teamed up with Master.
Who did you team up with? Might have lost her.
Vaccines.
Oh, did anyone hear Janelle's response there? Could you just repeat that last part, Janelle? I was just trying to hear who you guys are teaming up with for the clinic.
Oh, Mass Department of Public Health.
Mass Department of Public Health. Okay. So that kind of goes into our next question about what support you utilized in your response. And it sounds like Mass Department of Public Health is one of them. Will that be your first vaccine clinic that you guys are holding, or have you guys been already doing them?
We've been already doing them. We've been having slots, and they've been, you know, this one Heinz Convention Center, they've been holding them at. So we had received 100 slots for vaccines from Mass Department of Public Health.
And
so,
do you think that's people are still signing up for those?
We're in a stop. There's not a high need, not a high demand, which we're trying to get more people out. And we will be doing our mobile vaccine with IHS and Mass Department of Public Health, and teaming up with another Native organization to have people come out to get vaccinated.
Do you think, you know, the timing has played into that at all? Like, how has that impacted, you know, had this happened a few months ago, do you think there would have been more interest or less interest?
I think in the beginning, the high demand, and having now that in Massachusetts, where they just opened up walk-in clinics.
Mm-hmm. It's kind of like folks can kind of go anywhere at this point.
Exactly. Now they, you know, Pfizer approved for like the 12-year-olds and up to 15-year-olds. So maybe, you know, we can have more. We're hoping and planning to get more people in to get vaccinated.
Yeah. Do you guys have people in those age groups that you are serving right now?
We have our youth, and I can't say on top of my head how many youth we have, but we do have youth. So hopefully that families hear about, you know, their youth can get vaccinated, that we'll get more calls. So I'm being very positive that people will come call us.
That's good. That's good news. And then did you find that the state or federal agencies have been helpful in your process in the past year?
Yes, very helpful, especially with IHS Nuclear. We thank you guys for everything that you guys helped us with, you know, getting along with this COVID pandemic. We've been, Mass Department of Public Health been wonderful. They've been excellent. And, you know,
I think we may have lost Janelle again. Are other folks hearing her?
No, her mic went out. But I think Angel wanted to add to something he was trying to share.
Great.
Yeah.
Please do go ahead. And then we'll be moving on to the next one in just a minute here. So
I'm happy to jump in on the next
no, go
section.
ahead. We have a few minutes left in this section.
Oh, I was just gonna basically point out that I think you know, we started vaccinating our population in February, and there was quite a waiting list at that point, but because we were only vaccinating twice a month, and then we were learning the system at the same time. So obviously that was a challenge to train everybody, in the medical team, behavioral health team, because when I decided to vaccinate for our population, I wanted to do an integrated process, meaning I didn't want just medical vaccinating people and sending them off back home. We wanted to integrate all of whole health first care model into the patient treatment. And so it was very comprehensive, meaning that, you know, and I think we're gonna do a presentation with NCUIH later to explain that process. I don't want to get into it too much, but the point that I was trying to make is that we are seeing our numbers sort of decline, and the need, and I don't know if that's associated with just the media around the vaccination. We try to counter that with stats and just facts, but we are seeing our numbers sort of decline, or at least the interest decline a little bit. And for example, next week we started vaccinating every Tuesday from March onward, and we're seeing that, like, for example, our next Tuesday clinic only has 5 second doses and 5 first doses, whereas we were vaccinating 20 people, 40 people in total every week. And so I'm not sure what strategy we're going to come up with in terms of how to increase that interest. We're thinking that some of our population, based on some comment and feedback, that a lot of them just don't want to leave their home, especially elders. Elders are more likely to not want to expose themselves, so they feel safer at home. And that's all I have to say about that.
Do you guys have any mobile sort of unit that you could use to go to the people's homes to vaccinate them?
No, not yet, but we're going to put that in the ARPA scope of work. You know, the new
Okay.
funding that's coming down. We're going to put that in that scope of work.
Great. That's and how has navigating the new funding been helpful?
Well, they have had several sessions for ARPA to really define that. I think the monies that get allocated to us are much easier, like that, like ARPA and the CARES Act funds and the PPHC and the NCUIH CDC fundings. Those fundings, I think they're very attractive for us because, you know, it's a scope of work, a budget, and there's no strings attached. You get the money. But going after other types of monies like grants and things, it's been very challenging. You have to spend countless of hours writing your scope and your project narrative, and, like, you know, it's difficult to say the least. So those are challenging. We're trying to, one last thing. We're trying to purchase our property right now, and that's a challenge right there. The seller's willing to sell our property. You know, COVID, commercial real estate is going down the drain, and we're going to be forced to move out if we can't purchase this property. And so we were hoping to get such approvals to use some of this funding to buy this property because we have an interest of turning it into a primary healthcare facility, FQHC lookalike. So if we can't do that, we're going to be out in the street pretty much.
And have you guys started to have those conversations with your IHS area office to include those in your scope of work, and they said no? Or are you just anticipating it's a possibility at this point?
Well, I think the difficult part of that is that, you know, we have our contract officers and our project officers, and they do their best to really explain or recommend. They're not attorneys. They didn't write up the laws for all this funding. So that comes with a lot of legislative requirements. And most of the conversation that we're getting right now is that the ARPA funding, the first round of funding we're going to be getting, it's not allowed for the purchase of a property and or the construction or reconstruction of property or enhancement of property. However, you could use it for facilities, meaning you can expand to lease more property. And they are talking about a second round of ARPA funding that will be allowed for construction and or purchase, but that money is not from the first round. So, you know, when that money's coming, I don't know, but I can tell you right now that we have some approved COVID-19 funding for the purchase of property, but it's very little. And that's not the ARPA money. That's a different, the fourth round of funding that we just got. So there is some, and we can use some for the purchase of property.
Mhm.
But I mean, you know, buying a $3.5 million property and you only get $77,000 out of that budget, when lenders are requiring 25% down payment for the purchase of commercial for nonprofit, it's not easy, right? I have to come up with, you know, $600,000-$700,000. Where am I going to get that money? We don't have reserves and we don't operate third-party revenue, so that's the limitation we face in terms of us pursuing the purchase of property.
That's really helpful. And yes, so there is 1.77 billion remaining to be allocated from the ARPA funding, the American Rescue Plan Act funding. And of that, there is 600 million that is supposed to be for lease purchase, construction, alteration, renovation, or equipping of health facilities. So that is something we're keeping an eye on, and we did advocate as well for that to be inclusive of urban Indian organizations. But we can continue this conversation offline. I'm going to pass it over to Andrew here. And Angel, I'll probably follow up with you. I'd like to hear how the rest of this process plays out for you and how we can continue to support you.
I just wanted to make an observation from the chat box. There was a question for Angel when he was discussing transportation that was asking, would Uber be helpful? Francis Crevier wanted to ask Angel if Uber would be helpful for his transportation needs or programs. I don't know if
Hey,
Angel
Mark,
heard.
I'm here. I think you cut out a little bit. I don't
Oh, I'm sorry. The question that Francis had about your transportation needs that you made a comment earlier, and she was curious if Uber would be helpful for your programming.
This is Francis. We're working with Uber to get free rides to the UIOs, so folks have more access. And I was just curious, I know you were talking about earlier the elders, and you know, I have an elder mom that I just had to get vaccinated. I definitely know how challenging all of that can be, and just was curious if Uber gave you free rides, if that would be of help.
I think it would certainly help. I'm always happy to receive any information you might help with that, how you're running that program and what kind of plan you're utilizing. We do offer outreach. We do offer transportation services, but we have limited transporters, and that's always a strain. You know, we don't have, because we transport behavioral health patients as well. And so we only got one transporter on each program, and that is always a strain. So I think the Uber recommendation is very attractive.
Yeah, this is specific probably for the vaccine for now, I think. But yeah, that could probably free up some of your transportation folks to do other things as well. So, okay, thank you.
Thank you.
And now we will go on to our next topic. We will have Andrew Kowick present that on the area of Beyond COVID. So Andrew, I want to pass the mic to you so we could go on to our next open forum topic discussion.
Yes, thanks for that. So we've talked a lot today about big successes as well as all of thinking back on all of the big challenges there's been over the last year. And the question on everyone's mind at the moment is what's next, especially with us kind of moving into a different phase of things. There's a lot of information out there, a lot of speculation, I should say, as to even just articles in the general public of what's society going to look like now that vaccination is happening, more things are opening up. Some people are on the side of there's going to be long-standing changes made to a lot of different things, including policy. Other people think it's going to revert to the status quo. And I guess some of my thoughts here are, if we think everyone's kind of thinking differently as what they anticipate to a future need over the next year as we transition into the next phase of COVID. So you can actually move to the next slide. I just want to ask everyone as to their, what's on their mind right now. So thinking about everything we've talked about today, what do you anticipate as a future need? And this is pretty broad. I have some follow-up questions as well, but I know people may be thinking about different things in different places. So if anyone has an opinion on what they think a future need that's on their mind right now would be.
I would have to say behavioral health. To be honest with you, I haven't seen the numbers of referrals for violence, for stress in the home, anxiety, people losing jobs, people losing family members. All of this is going to be sort of kind of that silent tsunami that's going to hit us in the aftermath. And the aftermath is going to be that folks are going to exhibit a lot of stress, a lot of stress, a lot of depression. And I feel that behavioral health, if we don't amp up our behavioral health system, we're going to be faced with issues that we're not going to be able to perhaps even support and provide the counseling needed in order to prevent, suicide and some of these other related mental disorders that cause people to take their own lives. So we're doing the best we could. We're spending as much as we can with suicide prevention efforts because we realize that homes are broken right now. In the Native communities, a lot of homes are broken, and the stigma with behavioral health is still very significant. So folks are not, they're not very quick to say, hey, my outside might look fine, but my inside is completely a disarray. So I just wanted to advocate for that because I think really that's going to be a huge emphasis for the next couple of years, at least for us as well, is what I'm saying.
I appreciate that. Thanks for sharing. I have a comment here from Rachel saying that behavioral health is also important to her because they've had an uptick in suicidal behavior. So I appreciate that input as well. Would it be fair to say that that's a shared need for you, Janelle, as well? It's possible she doesn't have audio.
Repeat that question. I'm sorry.
Sorry, do you think that behavioral health is a future need over the next year that you think is also going to be a priority heading out of COVID?
I agree. Like with a bunch of losses, people losing family members and their own grief and dealing with COVID grief, losing jobs, losing financial stability. So
yeah,
we will. Can you guys hear me?
Yeah, I can.
Okay,
Thank you.
You're welcome. I'm just making sure because my it keeps going in and out. So I'm sorry if I keep going in and out. But what I was saying, yes, I believe behavioral health, we would need more of that for our clients.
Okay.
Across the board, because there's so many losses and job losses, financial burdens, and
yeah, and so much change in a lot of different facets of life. I have a follow-up questions about this too, because we've heard this a couple times when it comes to behavioral health. And I think internally we had a question about how that would be structured. So would this be something that it would be helpful to have a specific grant program created for behavioral health, similar to something like SDPI that UIOs would be interested in applying for? Or is this something that, as part of your current contracts, it just needs to be, attuned to or enhanced? Not everyone has to have an answer on that now. Just planting that seed is in my list of questions. I'll give a minute to think.
I think special funding should be something you guys consider for this. I don't know if any of you have lost a loved one, but I know I did. And I can tell you that there was no closure for me. I could not go in the room, say my goodbyes because of COVID. And so, you know, these are the kinds of stresses I think that most of our loved ones are going to feel. Our community is already feeling. There's tradition, and there's a sensitiveness to having closure when someone dies. And this, with the pandemic and the rules and the guidelines of hospitals, even when I was willing to say, hey, look, listen, I understand the risk. I need to be in there and I need to do ceremony and I need to just, no, I'm sorry, you're not allowed, you can't. And so those kinds of things create, it just changes you inside, you know. And, you know, you know, these are the type of things that I haven't really talked to anybody about, but I don't really mean to get emotional about it. I just want to say that these are the kinds of issues that we're going to face with after the fact. And, you know, we don't get much funding for behavioral health services. I mean, our 350 contract doesn't give us, you know, thankfully telehealth and all of that has been very helpful, but there's issues with technology. A lot of our folks don't have internet. A lot of our folks live in rural parts of the community where access, you know, if you live mountain area, there's no satellite, there's no good connection is what I'm saying. So I feel people just need to be seen in person and go through that grieving process with somebody who's trained and a therapist who's able to provide that care.
Yeah, thank you for sharing that. I mean, yeah, there's a lot of complex grief right now. And so it sounds like if there was more of a dedicated program and grant program for that, maybe there would be more space to grow that, grow supports for that need long term. Is there any other comments on this behavioral health topic before I move forward?
Yes, this is Janelle. So I was, you know, I would feel, you know, as others having that special grant for more behavioral health, because personally, with me being a staff member and everything, I had my own struggles with my own family members having COVID. It wasn't, you know, we didn't lose anybody. They were all mild cases. But just having that, like my son had COVID back in December, January, and not being able to be with those family members, just like our clients, because if family members having COVID, they can't be near them. Like someone I know went to the emergency room, I couldn't be there. 22 years of his life, my first time not being at the emergency room. So even personally and professionally, even workers, staff members need mental health counseling around COVID, because this just came on last year and no one knew nothing about it. And so many family members stricken with it. Where do staff members go? Like, who do we turn to? Because we are the front person to take care of all our clients. And no one looking out after for the staff across the board. Like no one's looking out for like staff, because we're always designed to help clients. But what about the staff who are, you know, tired down, run down?
Yeah. Thank you so much for sharing that.
And Janelle, this is Francis. Just so you know, that has many of the CEOs that we have interacted with have said that the behavioral health of their patients and staff is of their utmost importance. And that's something we've been communicating to Congress often, that, you know, not to forget about you guys. So so I appreciate that feedback. That's very helpful.
Oh, you're welcome, Francis.
Yeah, and this kind of ties into my next question. So when we think about future needs and behavioral health, so we're thinking about folks in the aftermath of everything that's happened in the past year, who are current clients, current staff members. Angel, you also mentioned this volume of new patients. So people who've come in the door either for the first time or the first time in a long time, looking for testing or vaccination needs over the last year, or maybe even behavioral health needs, who didn't know the facility was there, but are realizing that it's a good resource at the moment. And we've heard this from a number of people where they might have a higher patient load this last year, even with everything going on. So when we think about future needs for those clients, in terms of expanding the current client base into the future, are there any needs that folks have thought of moving into the next year to maintain and provide for new or returning patients?
Oh, absolutely. I think that question is a really good question. In fact, this Friday, we have a community assessment event, and the whole premise of that event is around that question. We know that there are other unmet needs, and you know, some of our patients that have came just for the vaccine, that have came just for the for testing purposes for COVID-19 and prevention resources, have said, "Hey, listen, I got 2 bad teeth, and this issue I've had for a month and a half, and you know, I mean, from dental, what I'm getting at is from dental, the diabetes. There's folks that have type 2 diabetes that got assessed, weren't taking any preventative measures for their diabetic needs, and when they were assessed by the nurses, they were referred out. And so, you know, yes, we are seeing an increase of folks coming for testing and COVID-19 related services, but it's leading into other services that it's impacting our budget because we're only funded so much, right? So based on the numbers that we serve, it has been roughly hovering around, say, I'm going to just say 300 patients a year. Well, just this year, we haven't even ended the year, we're at 500. So we project that our numbers are going to be about 800 to 1,000 by the end of the year. But the challenge is how do we support that ongoing? Because I ran out of dental money. I had to tell patients, I'm sorry, we have a stack of files. I'm going to get chewed out probably in the community event, because there were some folks that were in that assessment treatment plan, and then all of my money is gone. I have no new monies, and thankfully I was able to identify some dental money. But all I'm saying is that's the impact. The impact, the reality is, how are we going to serve all of these new folks moving into the next couple of years? Because where am I going to find that budget or those new monies to support that? And that's really the challenge. It's going to be, how do we increase our budgets in a way that sustains that, because it's not sustainable. I have a lot of folks that have a lot of needs now, and those numbers have doubled. And so I'm not getting double my budget, on an annual basis. And so that's going to be really the challenge to continue to serve them. But this Friday, we're going to do a really robust community assessment from Friday onward to the end of the year. We hope that assessment will help us align our strategic plan for the next 5 years, so that we align our services to what the unmet priority need is within our community. So we hope to gather that data, and we're happy to share that data with you as well.
Yeah, that would be extremely helpful. I appreciate that. I was going to say, anything you can or feel comfortable sharing about that process, I think other UIOs would benefit from that as well. Because we've been hearing this, and I know even just briefly, CDC came out with a couple reports over the last month, one about STIs, one about cancer screenings, and one about vaccinations. And all of them showed that in general, the American public have been, there's been fewer folks doing the preventative healthcare aspects of that. So they're expecting like a higher need in general of a lot of things related to cancer, STIs, vaccines that are not COVID. So I think having a little bit more UIO specific information as a model for people to identify their needs going forward would be very, very helpful. I'm going to move on in the interest of time to my second question. And that is related to this, obviously, which is related to needs. What resources and trainings do you see as priorities for the next year? Whether that's something NCUIH can help fill in gaps around or connect to pre-existing resources, this is a helpful question for us.
More behavioral health trainings.
And is that for clinicians specifically, or for you know, UIO staff members as a whole, for more awareness on behavioral health?
More awareness on behavioral health. Staff members, clinicians, you know, because you never know who's gonna walk through your door, especially with outreach and referral, and having those, you know, crises at the moment. You know, our Baltimore office, we do have a clinical director just in case if, you know, he's not there. And we refer, since we're outreach and referral, we refer out to like the hospitals that have the best team. But it's getting those, connecting those services, you know, having more trainings around with behavioral health.
Yeah, that the plus side is I know that some of that is already in the pipeline. So I'm glad that's a need. And thank you for sharing that. Other than behavioral health and maybe community assessments, are there other resource or training topics that have come up over the past year that you think are going to keep being a priority?
I'm trying to think.
Yeah, take your time. Sorry?
More resources, not like more resources on housing, how to obtain housing, to secure housing, especially for our homeless population clients, because with Boston Housing Authorities, clients that don't know that it takes forever just to get into public housing or Section 8, given, you know, having those resources around. Because I let people know, like with Boston Housing Authority, it's very hard. And I'm not going to show it, oh yeah, it's easy. No, it's not.
Yeah.
Because I used to work for BHA and knowing, you know, it's not easy.
Yeah. When I was in Boston, I remember, and this was like 3 years ago, people were saying the average wait list time was, I think, 7 to 9 years.
Yes.
And I was like, I don't know if that's gotten worse during the pandemic, but I would imagine it hasn't gotten a lot better.
No, it hasn't. And even if you have a priority, like homelessness, domestic violence, it's still a wait.
Yeah, thank you. I think we have about, sorry, can I get a time check? Do I have 5 minutes? I know we're going to go a little over into the Q&A if folks are comfortable with that, but how much time do I have for the last questions? I think I have about 5 minutes.
You certainly have at least 5 more minutes.
Okay. Okay.
You've used about 20 minutes so far.
Okay. All right. Thank you. So related to housing, this actually relates to my next question. And so I'd like folks to keep thinking about resources and trainings they'd like to see. But I do really want to get to this last question, if you wouldn't mind advancing the slide. Because when you mentioned housing, this is actually something Angel mentioned too, where he said they've had a lot of success with emergency housing for folks who've lost their jobs or who've been affected by COVID. We've heard from some other people who aren't on the line today that they've had success securing housing for people who need emergency housing to quarantine. But I also know a lot of those funds are coming specifically from COVID-19 funds. And when I hear that, I think, okay, it's something people have had a lot of success with right now. But is this something where there can be more support to create a model for housing as a public health approach generally, even after COVID? Is this something where there's ways we can support you to develop this as a long-term health approach. So this last question is about what capacities have you been building over the last year? And how would that help with whatever comes next? I can leave this pretty broad. I have some follow-up questions too, but just because we were just talking about housing, that's something that I think is maybe something people didn't work on as much before the pandemic, but we've heard a bit about. I'm curious what folks' thoughts are on this. As what are you really good at now that might be helpful after the pandemic?
I'll just make a quick comment. I think I spent a lot of years on housing subcommittees with the County of Tulare, and I was working really closely with the Board of Supervisors because I had a network of investors who had owned, the dilapidated apartment complexes that were in, not the best side of town, and their numbers were very low, 20% occupancy, 10% occupancy. Nonetheless, I think it made a good model. We were proposing to solve the issue in Tulare County, because that's the county I live in, of the homelessness issue. So I learned a lot about what was going on then. And then I'm talking 7-8 years ago. Here's what we've done. Here at BIHB, I felt that it was necessary for us to have a memorandum of understanding approved by the Board of Supervisors in our county, in Kern County, to establish that referral, because the counties are going to be, they're pumped with a lot of money to solve these issues. And so I think that we need to leverage those kinds of partnerships, because I think it's going to start with them, right? The cities, the big, large incorporated cities, and the county governments, they're the ones that are tasked by the state to solve this issue of homelessness. So we established an MOU. The MOU now gives us the partnership that we need to really move on beyond a memorandum of understanding. In other words, we're on network calls. We're discussing, hey, here's our issues that our Native folks have. And then we have access to their treatment teams. We have access to all of their programs. We have access to their housing funded programs. And through Mental Health Services Act, the state, the 1% tax, that was I can't remember what proposition it was, 64 or one of those 60s. Mental Health Services Act funds 5 major key cultural groups or ethnic groups: African American or Blacks, Hispanic Latinos, LGBTQ, Native Americans, that's us, and Asian Pacific Islanders. That money is funneled through the state, HHS, down to the state, local public health counties, to solve a lot of these issues that our Native population is faced with. So you really have to follow the money and follow the policy. And the MOU process is one of those ways to really create, if you will, the needed relationship on paper, so that you can move beyond just the collaborative efforts. You can move on to actually leveraging the resources, saying, hey, I got a referral for you on that permanent housing project you have for transitional age youth. Here's our referral. Here's our patient. And they fund those programs. So it really doesn't impact your budget in any way. But if you don't have those MOUs with the county, and you're not discussing with the Board of Supervisors your issues, then you're kind of left out in a sense.
Yeah, thank you for sharing that approach. That sounds great. And so you said that MOU was in place before the pandemic started, correct? No.
Not. I spent nearly 6 months trying to get that MOU when I first came on to Bakersfield. And I took the initiative to contact the Board of Supervisors to set the stage, but the MOU was recently approved about a month ago. So
oh, okay.
Yes.
Congrats. That sounds great. Is that MOU something that you think would be shareable for other UIOs as like a model, a template?
I'm going to share both of them with you. Now, I was going like for the big, I want the world on my hands, right? So I had wrote an MOU that was very inclusive of all county departments. Their legal team was like, oh man, this is going to take us, a couple of years. And so I'm going to share with you the very robust one, because that's the way to go. If you can get a one inclusive MOU that includes all of their departments, I had our attorneys write it for us. That's the best way to go, right? Because then I'm not wasting my time. I can get all directors in one room and tell them, hey, this MOU says you have to work with me. But the one I'm going to share with you is both the one that's very robust and the one that I had to go with because they were recommending, hey, if you want this done faster, work with the Kern County Behavioral Health Recovery Services independently from the other county government departments. And we can get this MOU because we believe in you. We want to support you. And so we did that. So you'll have two versions of it. Just know that I'm offering that context because the shorter version is the one that did get approved. The very robust version with a lot of pages and a lot of legal stuff, that's the one that did not currently get approved.
Yeah, that makes sense. Thank you. Thanks for that context. While we have the time, I think that's a great example of something like a change that's occurred during the pandemic that's going to have long-lasting implications. I'm curious, even apart from housing, if there's other topics where anyone on the line thinks that applies. Because that housing example, it kind of has a couple dimensions. There's the MOU, there's also those strengthened relationships that have occurred during the pandemic with local government. And so I'm curious about other long-lasting either partnerships, documents, programs, things like that.
Adequate health insurance.
Oh, of course. I'm curious about that.
Because we're outreach and referral, and a lot of we serve a lot of urban Indian urbans. So when they come off their reservations, there's not an IHS there. Then they come to us with no health insurance. In the hospitals in Massachusetts, if you don't have no health insurance, they're not seeing you. Because when you call the clinic up and I would like to make an appointment, the first thing they ask you if you have health insurance. If you say, no, we can't service you because you have no health insurance, you have to go through the state. And some of my family, like for those who don't make under a certain amount, you cannot get the government assistant health insurance. And where we're at in Boston, to go to an IHS, you have to drive like 45 minutes or 2 to 4 hours to Maine, or 6 hours to Maine, 4 hours to New York, or around local. A lot of the people that we serve does not have transportation, can't get across because of the barriers that they're facing. So having more health insurance information, which I love doing, connecting families to health insurance, because that's the important key, is having health insurance. Without health insurance, how are you going to survive and live and take care of yourself? Because I have a lot of people coming to me, oh, they can't see me because I don't have health insurance, especially with COVID. Everything's COVID. They're neglecting their other health, such as diabetes, such as mental health services, such as heart conditions. So they can't get that access.
Yeah, so I appreciate that. So are you saying that enrollment and that outreach and enrollment component is more helpful than ever? Is that something that's your program has changed in how you approach over the last year too?
We do outreach. We always been outreach referral. So we assist in people connecting those services such as health insurance, helping them fill out health insurance, connecting them to IHS, transporting clients to their appointments. So.
Yeah, thanks. And has insurance enrollment, has it gotten at all easier over the past year? There were some state funds around enrollment, and then there were also some funds around treatment for people who are uninsured related to COVID. have you noticed a difference over the last year when it comes to either treating folks without insurance, providing referrals for people without insurance, or enrolling people? You don't have to, I'm just curious.
I'm sorry, this microphone.
No, it's good.
No, I'm saying that, you know, we had an increase of, you know, connecting our families with health insurance.
Okay, that's good. So it sounds like, you know, maintaining that increase into the future is probably very helpful as well, because insurance is always going to be a need.
Oh yeah, especially for the families that.
I think you cut out again. You said especially for the families. All right, I think we lost audio. I'll wait for a sec. All right. So I'm sorry, Janelle, I think we lost audio. We have about 2 minutes left. So I just want to kind of open the floor to see if there are any final comments, questions related to this or anything else. For any of us as speakers, if there's anything we can provide, otherwise we can move into the wrapping up stage.
No, this has been very helpful. Thank you for having this open forum, you know, discussing and learning about different agencies. You know, there's challenges that they have this year with COVID.
Yeah, I wanted to add and say, add to that and just appreciate Janelle and other UIOs that spoke today, Angel, for really sharing with us, you know, your wins, but right, and then ways of trying to, you know, pivot and better support your communities was also helping us identify next steps into, you know, following up on some of the identified areas of support, from mental health trainings to raise awareness for staff at UIOs that will support on working on, to following up on concerns around facility funding and buying facilities. So we will definitely, I know with Meredith to share, she'll follow up with you, and we'll make sure, Angel, that we do that. And also any things that might be of help to share with the community members. So we'll follow up with you on Angel in regards to maybe providing that MOU and your program overview of the emergency housing program that you have like to share with other UIOs today. In addition to this, there's a link to the survey monkey that we really appreciate for folks to take. It really helps with us in being able to improve our these sessions. I think there's going to be others. We're going to have a division of behavioral health listening session for urban Indian programs during our conference. So we just want to see how else that would be helpful in improving that, so y'all have the space and the time to engage, and maybe other ways you want to engage. I don't know if polling questions might be helpful, but it just we really appreciate your support, and if you could please press on the survey link and take it, we would really appreciate it. And you know, at the end of the day, we just want to be better for all of you. So thank you for the great work you do. Y'all are inspiring, and continue to do that great work. I don't know, Andrew, Meredith, if you had anything you want to add.
I just want to say thanks.
Thank you so much.
Yes, and we're always here. You should have our emails either on this slide or on the website or just in general, but feel free to reach out at any time if there's anything we talked about today that you want to follow up about.
I'll
Thank
send
you
those
so
attachments
much.
via email. I just want to let you guys know, I'll send those attachments via email.
Thank you. That would be great.
Thank you so much. And we'll send the PowerPoint to all of you too as well for today's call. And we'll definitely do follow up in working on the thinking beyond COVID, but also thinking about what's really important also now to help y'all in this time. So look forward to working with all of you. Thank you, Janelle and Angel. Y'all doing some great work and are inspiring. Continue to do that, and look forward to continue to work with y'all. On that note, we are 2 minutes over, but I hope everyone has a great rest of your day.